didn't necessarily think of myself as a carer.
I wasn't really a carer, I was a mother, and that was it.
My husband was first taken ill in 1993, and I guess that's when I first got the label.
It did change our lives considerably, because he then tried to commit suicide.
Actually, my role as mother was changing quite dramatically.
I had to accept the fact that I was a carer.
In the past, maybe the services were specifically directed at the service user or the patient. The carer kind of tagged along a bit. Most consultants now take into account that it is the carer actually who is probably be doing 23 hours per day.
Transition from hospital to home, I was quite shocked. I thought there would be someone who would lead that, but I've suddenly, or quite quickly, found out that it was me that would be organising education, physiotherapy, all the care services. You suddenly become an advocate and have to, I hate to use the word fight for the services that you require. So you start to have not only a direct caring role that's physical and emotional, but also you have to start becoming very organised in terms of who you speak to and knowing who you speak to.
If your son doesn't want you to know this, you're not going to be told it. It's up to him. So if things went wrong, you had to pick up the pieces, but you weren't actually involved in it as much as you should have been.
The biggest barrier, I think, is probably how I feel my role should be as his carer and advocate, and how the professionals see my role. I suddenly find out things that are going to happen, or they ring me up and say, why weren't you at the meeting? Or no one told me about the meeting.
I think the biggest challenges within the healthcare system are when your cared for person is physically ill, because so many of the professionals who deal with the physical aspect of a person's health don't necessarily understand the mental health aspect. They don't realise that actually the two things are very much of a package.
What we found is the mental health provision's been quite good when we've reached crisis point, and that's the frustration. It took 18 months for us to get family therapy, whereas that if that had started a year ago, and a year earlier, it would have been a lot more beneficial to the family dynamic, which is now suffering because we didn't have access to that.
Being a carer does impact on your well-being. It often can lead to a lot of stress, and stress can also affect your general health.
You have to realise that you have to look after yourself, because if you don't look after yourself, you can't help that person. You can't give them what they need.
To have a good understanding from your GP that you are a carer and that you do have other responsibilities, etc., etc. I would urge all carers to make sure they register with their GP. That's very important.
It's very hard to admit that you're struggling when you've got a family to support. Seek out support networks like CRISP in the Bournemouth area, who hold all sorts of events, offer respite. Certainly if you've got a diagnosis and you can become friends with other carers who are in the same position, I think that's a huge step in getting support.
As a peer support specialist and helping other carers, because I've been in the system for a few years, I do know how to navigate around it. So I can give other people advice and really help them discover what services are out there, and that they are not alone. Most definitely, they're not alone.